This is basically a discovery session. In this particular session, we're going to basically going to go give an overview of the whole program and what makes someone eligible for this program and how they can enroll in it. The name of the program is the National Diabetes Prevention Program. It's basically a lifestyle change program. For short term, they just call it DPP. It's a diabetes prevention program. So if you hear DPP, that basically means it's a diabetes prevention program. So a brief introduction. My name is Praveen Chinigapalli. I've been mostly a software engineer, architect for 25 plus years, but recently I've also started working on the medical space, biotechnology. I work for companies called Dexcom and Insulet, which they also offer solutions for people with diabetes. So this is kind of my way of giving back to the community of what I've learned. I feel like a lot of education can help people prevent diabetes, and this is like the humble effort to do that. Thank you so much for joining this. There are 5 goals for today's session. The first one is to learn about the type 2 diabetes, pre-diabetes, and the National Diabetes Prevention Program. And the next one is about how the South Asian DPP program can help you reduce your risk of developing type 2 diabetes. The South Asian DPP program is something that's being led by myself and Swati Garu. And this can help you discover some things about yourself and your readiness to make a lifestyle change and meet some great people as well. So, and then at the end of the day, have fun, right? That's what this is all about. We should be able to be healthy so that we can have a lot of fun. All right, so before you go further, I want you to do one thing, is to select one value that's important to you. And then this value, and then write it down. Like, for example, friendship, community, family, career, humor, gratitude, faith, religion, or spirituality. Out of these, just write down one value, and then describe a recent experience when you demonstrated this value. And then just write some, just think about it for a couple of minutes, and then we can use, we can get back to it at the end. So now we're going to get into the overview of the National DPP Lifestyle Change Program. Okay, so if you have type 2 diabetes, your body cannot properly use insulin, which could cause you to have high blood sugars, right? You probably know this. So what are some of the things that people who have diabetes are at higher risk of serious health complications? First thing is blindness, kidney failure, heart disease, stroke, and then loss of toes, feet, and legs. So these high blood sugar levels impact the tissues. Like in the case of an eye, it impacts the retina. So for all these things, it affects different types of tissues in your body, which causes these sort of issues. But it's very progressive. That means, it takes a long time for any of these can happen. It also depends on the severity of the type 2 diabetes as well. So I definitely don't want you to scare you, but I'm just saying, these are some of the complications. And you are at higher risk for type 2 diabetes if you're 45 years plus old, you're not physically active, and you're overweight. And then we'll get into those details, like, what that means. Because what's overweight to somebody is not overweight to somebody else. So what does CDC recommend? By the way, I keep using CDC. CDC stands for Center for Disease Control. This is a US-based organization. That's a very science-based organization. It does not believe in it's not, any research that they output. They have some, any advice that they give out, it's based on some research. And then that research involves a few, people who have done some studies on some people, and they found few things. So it's, It's not something for profit. It's not something for, for religious or faith purposes, but it's more for, general good. That's the assumption. Of course, there are a lot of people who don't debate with that, but, I'm not here to argue. So, okay. So have you heard of prediabetes? And then what is prediabetes? And then, and prediabetes is if your high blood sugar levels are higher than normal, but not high enough for type 2 diabetes diagnosis. And then if you have prediabetes, it increases the risk of type 2 diabetes and heart disease and stroke. So yeah, I mean, you might have seen here, these are like, higher risks, but these are the complications that you will have. They are higher risk, but if you're pre-diabetes, you have some risks. So it's all about, how do you reduce the risk, right? So the National Diabetes Prevention Program was rolled out, and they basically have a lot of evidence that if you follow this program, that you can prevent type 2 diabetes. Now, first of all, you have to find out what you have type 2 pre-diabetes, which means you go see your doctor to get your blood sugar checked. Or if you don't want to go